everyone, and welcome to another episode of Autobiology. Today, I have with me Dr. Erin Kinney, who is a naturopathic doctor, wellness coach, and speaker. Now, she's actually a stress reset expert, which I think we can all identify with. And I'm really excited to learn about her methodology because she's the founder of the Stress Reset Formula. So I'd like to give a warm welcome. Thank you, Dr. Kinney, for joining me today.
Thank you so much for having me. I'm excited to be here.
So what is it that you do specifically? Because I know, in my research, you have said that you help stressed and burnt out women with adrenal fatigue to improve their mood, balance their hormones, increase their energy. But I think a lot of people don't even understand, what is adrenal fatigue? Can you just
Sure.
give some background?
Yeah. So first, I think it's important to understand what happens in our bodies when we get stressed, right? I'm gonna kind of back up and start from the beginning. So we have this part of our brain called the amygdala, and this part of our brain, I like to call it the lizard brain. It's kind of this old part of the brain. It's right at the base of between your occiput and your spine, and it basically has an on or off button. It will be, this is a stressor or this is not a stressor. And if something is a stressor, it sends a signal to our hypothalamus and it basically kicks off the stress hormone cascade. And the end of that stress hormone cascade is that we get a production of cortisol and adrenaline from the adrenal glands, right? So these two hormones are the hormones that will flood the body and allow us to go into fight flight mode, which is our stress mode, if you will. And when that happens, all the blood flow goes to the arms and the legs, our pupils dilate, our heart rate goes up, our blood pressure goes up, our blood sugar goes up. Essentially, our body gets ready to run or to fight. And the unfortunate thing about the human body is that no matter what that stressor is, so if that amygdala deems that something is stressful, right? It might be an email from your boss. It might be being stuck in traffic. It might be a lion chasing you. So it might be something that you literally need that fight flight response, or it might be something that you don't. Like maybe someone says a comment to you when you're out or you're scrolling on social media and you see something that gives you that fight flight response. You don't necessarily always need that increase in blood pressure, heart rate, blood sugar, blood flow to the arms and legs, but we get it no matter what happens, what the stressor is, correct? Now, if we're stuck in chronic fight flight, this is where problems start to arise, right? It's normal for us to have that stress response. The stress response allows us to deal with stressors, right? It allows us to, if something is chasing us, to run and get safe. And the way that our bodies are designed is that once we do get safe, that same cortisol, which is, that stress hormone, it will go back to that hypothalamus and it binds to a receptor there. Basically, I like to call that your off button. We can talk about the nitty gritty science behind that, but you have this off button. So that cortisol that floods your system and allows you to go into fight flight is also the same thing that turns off your fight flight response and then allows you to calm down, right? So if you're stuck in fight flight, or let's all think about March of 2020, right? We can all remember that time. The world was shutting down. Everything was not so great. We were constantly getting our amygdalas were firing on a constant, every 5-minute basis, stress. So our bodies, which are very wise, were kind of like, you know what? I'm not sure I'm going to turn the stress response off. I'm just going to keep her in stress mode. So it actually downregulates the production of that off button I was talking about. Much like the way that type 2 diabetes gets developed, where the body starts to downregulate insulin receptors, the body stops making this off button or the glucocorticoid receptor in the hypothalamus, which allows ourselves to turn out of fight flight. Now, if this happens, we essentially then get stuck in stress mode. And if you're stuck in stress mode, this is a problem because cortisol, while it's the stress hormone and it actually has other beneficial properties. So cortisol is what gives us energy. It's an anti-inflammatory. It's a really important hormone. It's our body's natural prednisone or natural steroid. So if we don't have enough of it, that's a problem. And I like to call it a metabolically expensive molecule. It takes a lot of building blocks. It takes a lot of energy for the body to build it. So if we're stuck in fight flight mode, constantly pumping out cortisol, and we're not able to rest or sleep or do anything like that, we will eventually start to have our levels of cortisol start to decline, right? And this is where we start to see burnout or adrenal fatigue happen. So our adrenals are now like, holy cow, we've been pumping out cortisol 24/7 for a year and a half. We don't have all of the nutrients that we need in order to keep making this cortisol. So the cortisol levels will start to decline. And this is where people will start to feel tired. They don't want to get out of bed in the morning. And in order to, if we're still getting a stress response stimulation, so if the amygdala is still firing, if the body doesn't have what it needs to produce more cortisol, it will overcompensate by producing more adrenaline, because adrenaline, conversely to cortisol, is a very cheap molecule. The body can always make adrenaline. So if we're making a lot of adrenaline and we're not making a lot of cortisol, it's what it feels like in the body is if you've had 15 cups of coffee on no sleep. So you're going to feel very anxious. You feel that tired but wired, and people will start to get allergic responses will get up mediated. People will start to get joint pain, body aches. Their hormones might, women's cycles may start to get off. Their sex drive will go down. So we start to see a lot of these different systems, and it may hit multiple different systems at a time. But so when people end up in my office and they have, they maybe have digestive issues, they're having PMS, they have chronic fatigue, they might have joint pain, they might have muscle aches. At the end of the day, usually the root cause that I'm seeing is that they're in this adrenal burnout place or adrenal fatigue place. So that was a very long-winded answer to your question on what adrenal fatigue is. And if you're someone who's thinking, wow, I think I've been stressed for a long time, and you're listening to this, adrenal fatigue can manifest in a lot of different ways. It kind of just depends on where your body is lacking that cortisol energy, if you will.
Yes, and that was an awesome explanation. And you hit on a couple of points, that listeners have asked me about. So I have a couple of things. So, and I'm not sure in what's the best order to answer them in. But I've been asked things like, because people are kind of wise, they understand that cortisol is sort of the natural prednisone, right? As you said. So what happens when people are coming off of steroids, off of corticosteroids? Because I feel just like you're saying, like that system's been tampered with, right? So how does the body regulate that? And then how is this process different in women than in men?
Okay, so I'm going to answer the question first about steroids. So what's interesting is a lot of the research that I've delved into when I was researching adrenal fatigue and kind of treatments and whatnot, a lot of the research has actually been done on people who are coming off of steroids, who've been on long-term prednisone treatment.
Okay.
And the interesting thing is, like, currently I'm treating a patient who has to be on prednisone for a long time because she's had a lung transplant. Part of her anti-rejection protocol is
absolutely
she's been on prednisone, and she has to be on that. And she has prednisone-induced diabetes because of what the prednisone has done to, because like I said, when you have cortisol in the system, cortisol tells the body to increase blood sugar. So her blood sugar levels have kind of gone unchecked. She's got all kinds of complications that look very similar to my patients that have adrenal fatigue. So prednisone, essentially, if you're on prednisone, it's like putting high levels of cortisol in the body. And what it will eventually do the longer that you're on it is prednisone will cause a downregulation of that receptor that I spoke about in the brain. And so it reduces the body's ability to turn off. It also, so just like glucose needs to come inside a cell, right? We don't want too much glucose or too little glucose in the bloodstream. We want glucose to come inside the cell so it can do its job. The same thing with cortisol. Cortisol, it needs to be inside the cell. So we measure blood levels of cortisol, and we don't want them to be too high, nor do we want them to be too low. We want them to be kind of, they should be higher in the morning and lower in the evening. If they are too high, that can be one of two things. Either you're producing so much of it, or it can also mean that your body doesn't have the receptor it needs to bind it into the cell. And cortisol's job in the cell, once it gets into the cell, that's when cortisol actually acts as an anti-inflammatory. So a lot of people, this is why we give prednisone to people that have joint pain or unchecked inflammation. We use prednisone because it will immediately calm it down. Now, again, if you've been on long-term oral prednisone or prednisone injections, the body will start to downregulate the production of the receptors that allow cortisol or the prednisone to come into the cells, and we can start to see issues from that. So does that answer your question?
Yeah, absolutely.
And now your question, and how does this differ in men versus women? It actually really doesn't. What will differ in men versus women is kind of the fallout from this, right? So the symptoms that people may experience.
Okay.
And because women have, more of a cyclical, if you're a cycling female, adrenal fatigue can play into the role of PMS and problems with the menstrual cycle. That's usually one of the first things that I will see in women is when their adrenals get a little bit messed up as they come into my office. They're like, oh, I'm getting really bad PMS, or my period length has changed, or they're heavier. There's a change in the cycle. Men often don't tend to see symptoms from adrenal fatigue until it's really bad, is what my observation has been in practice. Granted, I treat more women than men, so I'm not entirely an expert on men. I'm more an expert on women. But what I will say is men, eventually adrenal fatigue will start to cause a fall in production of testosterone in men, but typically they won't see symptoms in that until their testosterone has fallen quite a bit. So men have kind of more of an ability to kind of push through this. That may be a mindset, I'm not sure, but the physiological effect of what's happening with the cortisol and the glucocorticoid receptors is the same in men versus women. But I think I think women tend to see symptoms of adrenal fatigue first.
Okay. So when you do have the adrenal fatigue, how is it that you help people get that back to a balanced state in the body?
Yeah. Well, so the first thing that we do, and you mentioned like I have this stress reset formula that I talk about. The first part of that is I explain this to them. I explain exactly what we're talking about because I need them
Right.
to understand here's what's going on. And they're all like, oh my gosh, that makes so much sense. No wonder. Like I've definitely been feeling like I just can't turn off. I'm stuck all the time. And they may tell me, hey, I've tried to meditate, I've tried to relax, and my body just won't relax. That's because their body literally doesn't have the ability to come out of fight flight. So
Okay.
we talk about that. And then the second step is we actually want to start to do practices and lifestyle things and remedies. I use a lot of homeopathic remedies and herbal remedies that work on the production of those glucocorticoid receptors. So the body is able to turn itself off. So there are some treatments, there are some herbs, there's some different things that actually increase the production of that particular receptor that allows cortisol to bind either to get inside the cell or in order to allow the body to turn off. Because and there are other treatments we can do. Sometimes I'll use adaptogenic herbs, which have that property. Ashwagandha and rhodiola are really helpful. There's a lot of studies that show rhodiola in particular that will upregulate that glucocorticoid receptor. But what I find is that we have to couple the herbal homeopathic treatments with lifestyle practices. So anything that puts your body in a relaxed state, even if you don't feel it yet, the practice of it is really helpful. So this is why meditation is so profound and why it has such a profound impact on the body. When you meditate, the thing it's doing in your body is making more of those off buttons, making more of the glucocorticoid receptor. And even if you meditate and you're like, wow, I don't feel any benefit from this, you are getting benefit. It's almost like training your body how to relax.
Right.
So we talk about meditation. Sometimes that's not accessible to someone in whatever state they are. We'll talk about breath work. We'll talk about any sort of thing that they can do that's relaxing. So listening to music, just laying flat, maybe reading a book. So when I'm working one-on-one with patients, I talk about, okay, here's 5 different options that you can do. And then there's all this research on the practice of gratitude, the practice of joy, those things as well. You can't really be in the stress, fight, flight state if you're in gratitude. Typically, when you're in that gratitude vibration, your body's not in fight flight. So practicing that every day can also be a really helpful way of getting the body out of that fight flight state. And then, so that's kind of my underlying root cause treatment. Obviously, if someone's coming to me and they're like, I've got all this PMS issue or I've got joint pain, I'm going to be doing some, I guess Band-Aid is kind of really that, some natural remedies that can help whatever their current symptom is in the moment so they can feel better. Because it's hard to do these. It's hard to practice gratitude and joy. It's hard to meditate if you've got, really bad knee pain or if your PMS is so bad you want to kill your husband. So there's a few things that we'll do in the meantime while we're layering in those, those like lifestyle practices. And it's all going to be individualized based on, because again, adrenal fatigue is going to look, it can look similar, but it's going to be slightly different for every person.
Yeah. No, Erin, I love that you brought that up because, it's funny when I am talking to people about just biology in general, and for some reason, women sort of feel like it's a myth that, they kind of get bitchy, during PMS and stuff. And I try to explain like, no, this is really like a neurological process that happens. There are things that change during your cycle, that make you, it makes it hard for you to calm down.
Well, but so the bitchy or that mood change right before the cycle is actually, it has to do with the interplay between cortisol and progesterone. So typically the week before your cycle, your progesterone should be at its highest. And progesterone is actually the chill hormone. Progesterone makes you feel happy and cool and awesome. If you're in a little bit of an adrenal fatigue state, if the body doesn't have the building blocks to make cortisol, progesterone and cortisol can get easily shunted back and forth via another mediated hormone called pregnenolone. And so again, in that week before your cycle, oftentimes what happens to a lot of women is if their body doesn't have enough cortisol, it will steal from the progesterone stores to keep your cortisol levels up. So when you should be having a high level of progesterone, which would keep you happy right before your period, you get a progesterone drop off, which gives you that bitchy. So when women tell me they have major mood issues right before their period, that to me is a major sign that your adrenals are not functioning properly. So
Okay.
it's actually not normal to be bitchy before your period. I mean, it may be normal for you. You might be like, that's how it's been my whole life, but that's not, you shouldn't have major mood swings. You might have like some sort of small symptom, but getting really bitchy, really irritable is a sign that your adrenals are probably not doing what they should be, that your hormones are not totally properly balanced. Because again, progesterone is the like happy molecule. So
Right.
when things are really regulated, you should, you might be a little bit more tired or might be a little bit more inward, but the bitchiness is actually not a normal sign. So if you're
What
feeling that way, definitely go talk to your doctor about getting worked up for adrenal fatigue and hormonal imbalance.
So I had a question about somebody who said that actually it was worse for them right before ovulation.
Yep. So that's common as well. And so there, and I like to use this kind of analogy or just this like thought process that your body's either making stress hormones or it's making sex hormones. Biologically, we're not really designed to make both. So you have two peaks of hormones in your cycle. Ovulation is typically when you have an estrogen peak, and it takes a lot of energy to peak that estrogen and then peak the ovulation hormones. Again, if your adrenals are not that great and your body's struggling to make a lot of, you might not make as much estrogen as you need to, which will make you feel slightly bitchy. Or so one of two things could happen. Either you're making way too much estrogen, and that can be another issue. But I think in most women, if they're getting that, the body's not prioritizing ovulation, or it is prioritizing ovulation, and you're getting a crash in your adrenal hormones, and you feel so. Again, it's kind of like if there's not enough of a, if there's not an abundant source of building blocks for corticosteroid hormones, which steroidal hormones include cortisol and include progesterone and estrogen and all of our sex hormones. If we don't have enough of those building blocks during ovulation and right before the period, the body's like, well, I got to choose one or the other. And if we don't have enough of both of those, we tend to get symptoms,
Okay.
mood symptoms in particular. Does that make sense?
Yeah, absolutely. So on that same vein of thought, then how do you help women who then are shifting, right? Because we have like pre, peri, and post menopause,
Yeah.
right? So now let's talk about the women who they're not going to be making that full production of estrogen like they used to. So
Yep.
how does adrenal fatigue, or how is adrenal fatigue affected, by that shift?
So typically women will feel adrenal fatigue symptoms more during any of those changes. So anytime we're going through a major sex hormone shift, so whether that's during puberty or whether that's right after a pregnancy or during a pregnancy, like when we go from being not pregnant to pregnant, or when we go through perimenopause. So I like to think about the endocrine system and since we're video, you guys can see we've got a triangle of your major endocrine system. We've got sex hormones, adrenal hormones, and thyroid hormone. And so they're kind of, anytime we move either one of these up or down, it's directly going to affect the other two. So if stress goes up there, or if sex hormones go down or thyroid goes down. But the thing that is holding that triangle up, so I've got a pen, is your blood sugar. So blood sugar is what keeps that regulated. So keeping your blood sugar stable is really, really important during times of any sort of hormonal change. The female hormone system is very complicated. And the only way I've been able to I love analogies. The only analogy that I've been able to make sense of this, it's like a perfectly orchestrated ballet where there's lots of people that are participating. They all have to be on stage at the right time, doing the right moves in the right costume. If you have one person running across the stage in the wrong costume at the wrong time, you will ruin the whole show. So this is kind of what it's like with female hormones. And when we're going through a shift, it's like we have a cast change. It's like someone new has come in and everyone's like, oh gosh, there's a new person. We got to figure out how to play with them. So perimenopause is a big one that I treat women for. They're coming in and they're like, they don't feel right. And it's interesting to think about women during perimenopausal time in life. Typically, they're in their late 40s, early 50s, and if they have children, they may have aging parents, they've got a spouse. They typically are in a major caretaking role and they're taking care of a lot of other people. And oftentimes there's not enough time for themselves. So their stress level is tending to go up while they're undergoing a major sex hormone change. And what tends to happen a lot is their thyroid takes a really big dip. So we've got underproduction of sex hormones, overproduction of stress hormones, and thyroid tends to take it. And so that's a lot of times we'll see a lot of changes and oftentimes the thyroid hormone is what we can have an effect on. So I end up treating a lot of women for thyroid disorders when they're in that stage in life. not everyone. It's important to make sure you get tested for that stuff. But um, so I could talk about this for a long time because there's lots of different ways that this can go. But I think
Right.
at the end of the day, if you are a female going through this, my message is always make sure you have somebody that is helping you through this. Like find a practitioner that knows what they're talking about, that's running the right tests, that's listening to you, that's on my podcast. It's like my message every episode. I'm like, make sure you have help, right? It's really important to have someone holding space for you, particularly as a female, because females tend to be caretakers for many others in their lives, children, parents, friends, whatever it is. And oftentimes we get put last on the list and our bodies usually are like, hey, wait, I need some help. Where's me?
Yes. Yep. Okay. So that's a great segue into the fact that you are a naturopathic doctor. And I think a lot of women, people in general, have misconceptions or incomplete understandings, if you will, of what a naturopathic doctor is versus your traditional Western doctor, your primary care person,
Mhm.
your gynecologist. So could you fill us in on, what the differences are, what your background is and what your education is like?
Sure. So I'll just use myself as an example. I went to Vanderbilt for undergrad. I was pre-med in undergrad. I wanted to be a doctor ever since I was, 5 years old. I wanted to be an ER doctor. I did a stint in an ER when I was in my second year at Vanderbilt, decided that no sleep was not for me and ended up being a psych and a business major. I came back to naturopathic medicine school after working and going through a serious case of depression. I had a naturopathic doctor really help me. And I was like, wow, I never knew this type of medicine exists. This is really cool. He spent a lot of time with me. And then I kind of delve into like, well, what's the difference? And so when I applied to naturopathic school, I had to have all the same prerequisites that I would have had to have going to medical school. And I had actually dropped out of pre-med my second year of Vanderbilt. So I had to go back to school for a year, finish taking, organic chemistry and physics and all of the pre-med requisites. And then I applied and I got into naturopathic medical school. And naturopathic medical school, it's very, very similar to med school. In the first 2 years, you do all your basic sciences. I had a really good friend from Vanderbilt who was going through med school the same, like we were the same year.
Right.
And we used all the same books, for like, we learned all the same basic sciences. So we used the same pathology book. And then during my second 2 years, I did clinical rotation. So, I did a gynecology rotation, I did an oncology rotation. And the main difference between my education and my colleagues' education was that from the very beginning, we were taught to look at the body a little bit differently. So our philosophy on the body is that, okay, you may have two patients that you're treating for diabetes, but their treatment may look very different because we're in naturopathic medicine. We're always trying to figure out like what's the underlying root cause. And I'll use diabetes in this example because sometimes diabetes could be very much like, someone's blood sugar is off because they're eating a ton of sugar, right? Their diet is bad. They eat McDonald's, whatever.
Sure.
There are other cases of people. I have people that have A1Cs of 12.6, which just for you guys should know, like a normal A1C is under 5.7. This is a 3-month average of your blood sugar. And this patient of mine is a pilot, does not eat any sugar, doesn't even drink coffee, but his stress level is so high because he flies all over the world. And remember what I talked about in the beginning of this episode is that when your stress level is elevated, when cortisol is flooding through the system, it tells the body to increase blood sugar via, we always have glycogen, which is a storage form of sugar in the liver. So whether you've eaten sugar or not, when you get stressed, sugar comes into the blood. So this guy, giving him a medication that would help with diet and lifestyle is not going to be the right treatment for him. He needs to work on his stress management. But Western medicine would have treated him exactly the same. And he came to me because he was like, they're wanting to give me this drug that's going to lower my blood sugar. I don't eat any sugar. Clearly, sugar is not my problem. I have some other sort of problem. What's going on? So from the very beginning, while we're learning the same ways that the body can, have pathologies and the different ways that the body is supposed to work and then how it will end up not working if we don't treat it correctly, we were taught, to try to treat the root cause. Right. Now, great. And so I was trained in what I really loved when I was looking at naturopathic school versus med school, because I did think about going back to medical school because there are some limitations in being a naturopath. The state that I practice in, I currently can't write prescriptions. Not that it's something that I would like to do. However, there are cases where people come in and they're already on a medication and they might want help weaning it off and I might need to write a lower dose. Or sometimes I diagnose a lot of Lyme disease and sometimes I want to write a prescription for doxycycline, but I'm not able to do that. However, I was trained as a primary care. So I'm trained very well in drug herb nutrient interaction, which no one else gets that training in school. Western docs do not. I mean, they'll get trained in like in drug-drug interactions, but no one else gets trained in herb-drug interactions. And I can't tell you how many times I get people coming into my office and they're on polypharmacy, so 4 or 5 different medications. They
Right.
bring in a shopping bag full of supplements that Dr. Oz told them to take. And I'm like, okay, you can't take this drug with this herb. This is not a good situation. So I'm getting a little off track, but the point is naturopathic doctors are very, very well trained in what to do if someone's on a medication and they want to add an herbal medication in, or they want to add a supplement in. We're very well trained in what to do in that situation. And in some states, we do practice as primary care physicians. So in Vermont, in California, in Arizona, we have full scope practices. So it varies from state to state. So it depends on where you live. If you're someone who's interested in working with a naturopathic doctor, again, the benefit that you're going to get is a naturopathic doctor is typically always going to be trying to find out why. Okay, your body is in this state. Why? And they may use a treatment, like we may use a remedy, an herb, or sometimes even a drug if you're in a state where you can prescribe them as a Band-Aid while we're working on that underlying root cause. So yeah, did that answer the question?
Yeah, absolutely.
Long-winded answer?
No, it's perfect. And I think, I'm just going to be honest, Erin, when I first started learning about the differences, to me, I thought you didn't have all of the same education, to be honest with you. And I think that that's probably most people who have not looked into it, that's probably what they think. So I really wanted to impress upon the audience that, you are trained as, any other physician, but you actually have more training.
We do. We have more training in we start taking. So while we were I was taking all the same courses as my colleague in Western medical school. I also was starting to learn nutrition and botanical medicine and homeopathic. So his course load was maybe, he took 10 classes. I was taking 18 classes my first semester.
Yeah.
So it's a little, it should actually be 6 years naturopathic school, but they squeeze it all into 4. We all have adrenal fatigue when we come out of it. We're all burnt out like crazy because it's just so much information. But no, we're heavily trained in diet and nutrition. We're heavily trained in herbal medicine on top of everything else. So there is more training. I will say that not, and this is, I was the president of my naturopathic association for the first few years when I was in practice. And so I encountered a lot of people that were skeptics, and I had to talk to a lot of medical doctors that thought I was a quack. And so I've had this conversation a lot. And at this point, I don't really care.
Right.
Really busy practice. I don't really care if you want to think what you want to think. That's the problem. But I think the probably, if you wanted to argue, the one weakness that naturopathic schools maybe don't have compared is we're not required to do a residency. And I don't know that I would consider this a weakness, but after med school, everyone's required to go and do a residency. Naturopathic doctors can go out and start practicing on their own. Now, none of us are doing surgery. We're not doing complicated specialty practices. Most of us are doing general practice, which you don't always have to have, 3 or 4 extra years in residency of doing. So there's, there might be a little bit of difference in, if you're seeing a naturopath who's newer out of school, they might not have the clinical experience because they haven't done a residency. However, as far as the training back and forth that goes, we probably have more training if you're looking for an alternative type perspective. Does that make sense?
Yeah, that makes sense. So I know that you also tend to talk about the principles of naturopathic medicine. In fact, on your website, you do talk about the 6 principles. Mm-hmm. Can you just broadly go over those?
God, I remember that. I mean, first do no harm is kind of one of our big, which is the same as Western medicine. Right. I think the biggest principle that I feel and I use every day is that we have one of our tenets is doctor as teacher. So I spend a lot of time teaching my patients what's going on in their body. You can't see, but I have a giant whiteboard in my office. So when people come in, I'm drawing processes. I use physiology every day in my life. I draw out, I pull out my physiology book. I'm explaining, here's what's going on in your cell. Here's what's happening in the mitochondria. Here's what's happening in these receptors. And so I use what I learned in med school literally every day. I use organic chemistry. I use all of that, which I think is really cool. I talk to my colleagues and they're like, yeah, I don't remember any of that stuff.
Oh my gosh, I love it. You're speaking my
great. I love it too. I love drawing. I love teaching. And I love to teach workshops. And one of the things that I think my patients love about coming here is they're like, wow, I leave here and I understand what's going on in my body. I understand why my labs say what they do. So I also, when I do a lab follow-up, we go over line by line what each labs mean, what each lab number means. Because most times doctors are like, yep, your labs look normal, you're fine. And people might be like, wait, but this one was flagged as high. Is that scary? Is that not? And so I'll go through with them and I'm like, hey, yeah, this is normal. It's okay for this to be a little bit high if you're dehydrated, or this actually says it's normal, but it might not be optimal.
Right.
Actually, this is embarrassing, but I got to look up the other principles in naturopathic medicine because I don't remember. You said they're on my website. um,
Well, I'll just while you're
if you
doing
want.
that, talking about the why. I think for me, that's the biggest thing missing in Western medicine is,
Yeah.
they're really awesome at treating the acuteness of situations. Like you, you know, things are on fire. They can help you address the symptoms, put that fire out. But for me, it's always, well, why did the fire occur in the first place? And I think, if anything, naturopaths, like that's the strength of naturopathic medicine is understanding, you know, why did you get the cancer? What pathway is broken? How can we address, you know, if we're talking about genetics, what is your genetic hardware wired to do, and what are the gaps that might lead you to be predisposed to something? Um, Taking a look at your microbiome, asking what are you eating, how what are you doing in your everyday life, and I think those are the kind of questions that naturopaths instinctively ask that
Yes.
never come up with
Yeah.
your traditional Western doctor.
And I think, I have a lot of friends that are traditional doctors that I, went to school with and that I share patients with. And I don't think that they're not, I think in today's world, they are thinking about that. But I think that the problem that they run into is that when you're in an insurance-based model, they don't have the time to ask all of those questions because it takes a little
Mhm.
while
It
to
does.
get taught, especially if something's a lifestyle problem. You might be like, well, maybe we're looking for drug side effect or food side effect. But if something is like something going on at your job or something in your relationship, and a lot of stressors end up coming down to that. And if stress is kind of at the root cause, it's going to take a minute to get to that with a patient. So time, the amount of time that your doctor spends, and this is the one benefit of seeing a naturopath, is typically their visits are longer. So you're going to get more time. And in that amount of time, they can get to some of the root causes a little bit, easier than someone who has 10 to 15 minutes.
Yeah.
Um, yeah, so I will read off the six principles. So it's first, do no harm, the healing power of nature. So we really believe that herbal medicine, sunshine, being outside, drinking water, like the basic things. I once had when I was first in a naturopathic clinic, one of my teachers was Dr. Diadamo, who's the author of Eat Right for Your Blood Type. He's a
Yes.
mentor of mine. And I had this really complicated case. This woman had, multiple chronic diseases. She was on a lot of different medications. And I brought the case to him and I was like, I have no idea what to do. And he's like, the more complex the case is, the more you go back to basics. He's like, let's start with water. Let's start with, is she pooping? Let's start with how much time is she getting outside in the sunlight? Let's talk about sleep. And I use that every day when I get a complicated case that comes in. We always go back to the basics. And those basics tend to be the power of, basic nature. So are you getting outside enough? How much sunlight are you getting? Are you drinking enough water? So, and that can also play into, herbal medicine and the amazing benefits that plants can give you. And then the third principle is identify and treat the causes, which we've just been talking about. So trying to find that root cause. And the fourth is doctor as teacher, which I talked about. And then the fifth is treating the whole person. So not just treating, hey, you're coming in. I get some people that come in like, I have this rash. And they expect me to just ask about the rash. And I'm like, we'll talk about the rash in a minute. Let's talk to me about your sleep. And they're like, why do you care about my sleep? I'm like, because you're a whole person. I need to know everything about you. So, we treat the whole person because the symptoms are usually a sign that something is off in, the whole body. And then number 6 is prevention. So, while I treat a lot of people that have issues, but I will also get people that come in, they're like, hey, I'm doing great. I just want to make sure I don't end up getting burnt out. So what can I do to prevent that? So a naturopath will do a lot of prevention. There's a lot of work, and not a lot of naturopaths that will do cancer prevention or, aging prevention or, things where we can start to prevent the body from going in a direction we don't want it to go in. So those are the 6 principles. So again, I'm embarrassed that I forgot a few of them.
God, I hope I didn't put you in amygdala hijack.
Oh, it's all good.
But actually, I love that you brought up amygdala hijack at the very beginning of our discussion, or the amygdala in general, because I feel like people who have chronic stress issues think of the physical and the mental, but they don't, talk about environmental. And environmental stressors, I feel it can be, not only toxins in your environment, but they can also be what feeds into the physical and the mental, because if you are, and this is kind of my specialty, what I talk about a lot is if you are anticipating, a situation that you're dreading, you're immediately going to be turning on that on switch of the amygdala. And that's going to set off a whole cascade of events. And so just educating people, right, on what triggers that fight or flight or freeze response can actually be a way, like a really good first step in addressing how to avoid the eventual, cortisol spikes and adrenal fatigue and all that stuff. So I love that you brought that up. Um, so I'm just curious on your, and I know I want to be cognizant of our time, for HRT, because, that's something that a lot of postmenopausal women look at. And in my own research, I've done a lot of writing on menopause. And when I was doing the research, I was surprised to find out about all the Women's Health Initiative studies, what they thought about what HRT was doing in the 80s and 90s. And then what they found out it was actually doing in certain people with or without a uterus. And, so what are your thoughts on HRT? Do you use it? Who do you use it in?
My thought and answer to that is it's very case dependent. I think for some women, it can be wonderful. It can be really helpful. I think for other people, depending on their genetic makeup, their lifestyle factors, what's going on, it can cause more problems than it might be helping. I think first and foremost, if you're going to do any sort of hormone replacement, levels need to be tested on a regular basis. So if we're using estrogen, testosterone, progesterone, you need to make sure those levels are within a normal range. So, and if someone's got tanked estrogen levels, tanked testosterone levels, and my philosophy is, and this is kind of the way that a naturopathic doctor would approach anything, is we tried lifestyle factors first. If that doesn't work, then we move to an herb or homeopathic. And if that doesn't work, then we might move to like an HRT or an actual hormone replacement. There are a lot of herbs that you can use that will stimulate the body to produce more estrogen or produce more progesterone or produce more testosterone. And in some people, those work really well. And I find when you combine that with adrenal support and with the lifestyle factors that help, because again, if the body's too stuck in stress state, it's going to be very hard for the body to make sex hormones. But if we can get the body out of the stress state and we can use some herbal protocols and some other things, we can tell the body to make those hormones on their own. Now, I've had some cases where either the stress state is too intense, stress pathway is too intense, and we can't get it to shut down, and their symptoms are not manageable. And, we've run genetic testing and we know they are a good candidate for HRT. That can be a good option. So I guess my answer to that is it's very case dependent. And I have a nurse practitioner who works for me who does prescribe in the state that I'm in. And we will, in right cases, we will do HRT. If it's safe for that person, if we've gone through their family history, if they don't have a family history of breast, we've done the genetic stuff. Because hormone replacement therapy can put you at risk for certain issues. Now, there are other cases, I have a patient right now who's 35 and just had to have a hysterectomy because she had breast cancer, and she's does not have any estrogen related cancer, no genetics for that. And she's a good candidate for hormone replacement therapy. If she doesn't make estrogen at this age, she's going to be at a much higher risk for developing osteoporosis and a whole host of other things. So in her case, HRT is a godsend, right? So it's very case dependent. And I think that's the answer you'd get for most questions you're going to ask about, hey, what's your thought on, this treatment for XYZ? Again, it's going to come back to the individual. And then the other thing I will say is what's right for an individual, for a certain phase in their life might not be right for them at a different phase in their life. Like I get this question about fasting all the time. Hey, what do you think about fasting? Is this good for hormones? And my answer is usually, it depends. It depends on what's going on with your other hormones, what's going on with your stress state, what's going on with your thyroid, what part of life are you in? Maybe it worked for you in your 20s, or maybe it will work for you in your 60s, but maybe during menopause, this isn't the best answer. So, and I kind of am going to circle back to my answer that if you're listening and you're like, oh my God, I don't know what to do and I feel overwhelmed, find somebody who can help you through this. Find someone who is very knowledgeable, who can run the tests, who can help you. I think it's great to do your own research and have your own knowledge, but I think it's very hard to treat yourself. And I love what's going on in the world today. I love there's so much information that you can access about your health but I also, you have to be careful with all the information that's out there, because you don't necessarily know. You might read a research study, be like, well, that sounds good, I should do that. But how do we know that that's right for you? And as a very intense hypochondriac and a doctor, I have a team of people. Like I have all the knowledge, right? I could very easily treat myself for all the issues, but I can't because I can't be objective. So I have two naturopathic doctors. I have a life coach, I have a therapist, I have an acupuncturist, and I use them. And I'm very big on, and I do research. So I'll bring to my naturopath, I'll be like, hey, I've researched this. What do you think? I would like your objective position, so perspective. So I'm a really big fan of doing research, being empowered, but also making sure you are working this through with someone who can give you an objective perspective and opinion and help you make the best decision for you.
So I love that answer. That's, why I titled my podcast the way I did, Autobiology. So learn about your own biology and what's best for you. So to me, that's a perfect answer. And honestly, I wholeheartedly agree. I'm one of those people that make the toxic estrogen. And so I know that for me, taking extra estrogen is a bad idea. That will never be good for me. But like you said, for somebody else who's not making any estrogen, or, their estrogen pathway, makes the beneficial kind, that's awesome. And that's a godsend. But I think that a lot of people, especially people who have started menopause and are experiencing, issues, like you said, they read a study or they're watching a whole bunch of TikToks, of these women who got on hormone replacement therapy and suddenly, their sex life is awesome again and they have all this energy, but it may not be right for everybody. And I love that answer. So make sure you test and know what's good for you. So with that, I'm gonna close this out. I know I want to be cognizant of your time. Dr. Erin, do you have, obviously you have your website, which is drerinkinney.com, correct?
Yep, that's right.
Okay. And if people want to consult with you or telehealth with you, is that an option?
It is an option. Yep. So I offer a free 15-minute consult. So if you want to, call the office and set one of those up. And so I have two health coaches. I have a nurse practitioner. I have a bit of a waiting list, but I can get people in through I've trained people in kind of my methods to get in and I do all the lab orders and do the lab follow-ups. So you might do an intake with someone else, but you would eventually get care through me. And then I'm really active on Instagram. I do a lot of lives there. I post a lot of content there. I have a podcast myself if you want to go learn a little bit more about hormones, and I bring other guests that come on. And I've got a couple free downloads on my website if you want to learn a little bit more about adrenal fatigue and like easy ways to kind of hack that on your own. So you can go access that on my website. Yeah.
And the name of your podcast is
called The Dr. Kinney Show.
The Dr. Kinney Show. That's right. I did subscribe to that. So
Awesome.
I've started listening to your thing. And on Instagram, your handle is?
I'm just at Dr. Kinney.
At Dr. Kinney. Okay, great. Well, Dr. Erin Kinney, thank you so much for joining us today. This has been immensely insightful and educational, and I really appreciate it.
Thank you so much for having me. It was a blast.